We declare the OPENMRS and Helena 2018 conferences officially open.
Speaking at the conference, James Kariuki from Center for Disease Control CDC noted that the state of medical record systems in the country varies depending on the organization in question.
That is really dependent on different factors, and increasingly what we've realized is when you look at medical records, it's a factor of many things. There are some that are doing well and others are not progressing very well. One thing that we have realized over time is the role of governance and leadership in ensuring that we have good information or good medical record, which also play a role in terms of really defining what is our security measure in terms of how we use the information. So in short, it really depends on an organization and the policies and the laws enacted on that, and being able to follow on that to ensure that we are able to provide the information, and we are also collecting the information that's relevant is really key on this.
He further noted that several factors need to be considered in order to streamline medical record systems.
But bearing in mind that getting the medical records to be at a point where we can use it, we need to get to work on several aspects, including how do we exchange this information, what's the level of the functionality within our systems, what's the governance and leadership, as well as the capacity to both collect, analyze, and use that information.
Kariuki equally highlighted that all these efforts are not in vain, as a working medical record systems comes with its own benefits.
If we're able to measure and monitor how our systems are able to perform and produce the information, there are several things that we can do in terms of being able to provide the healthcare needed to the population. As an example, if we know that our systems are able to respond to diseases, for example, if we have a cholera outbreak and our systems are able to provide that information and is accessible to the people who make decisions or respond, that will be key in terms of being able to intervene and controlling the spread of that epidemic. Another example is HIV. In terms of knowing who's infected, are they seeking care, are they on ARV, which is critical in terms of reducing the transmission rate within the community. So the key thing is really getting the information in a way that people can understand it and also make decisions as to what they need to do about it.
With the country currently aligning itself to the Big Four agenda by the president, the public health practitioner noted that such a system will go a long way in integrating all the other agendas and identify how they can implement universal health care coverage.
In terms of understanding what information we have and plugging into the Big Four, one of the main important things is to understand how this information can play a role in ensuring that the other three agendas that support health also understand what health need, and getting that collaboration and understanding across what need to be done in terms of the infrastructure needed, the facility, the kind of support we need at hospitals, and how this information can be used from that level to the top, and also showing how this information is useful to the people anywhere within the country. So part of understanding what we can produce using our information system is core to knowing what the other agendas need to do to support this main agenda, including other ministries and other parts of the government.
With the conference being in its 12th edition, stakeholders are seeking to find ways of using open medical systems to strengthen primary healthcare, maternal and child health, and prevention continuity of care models linked to continuous quality improvement.